At present, in March 2020, there is no evidence that having POTS or postural orthostatic tachycardia syndrome puts you at high risk of either catching COVID-19 or developing a complication from COVID-19. The only risk you need to consider is the risk of a serious complication if you have one of the following conditions that are recognized to increase your chances of a serious complication if you did develop COVID-19. And these are things such as hypertension, diabetes, ischemic heart disease, heart failure, renal failure, or chronic obstructive airways disease or cancer. Now, it is very unlikely that if you have POTS, that you will have one of these other conditions. But if you did have one of these other conditions, then consider yourself high risk and take the usual measures to self-isolate as per your local guidance. Now, it is possible that if you were to contract COVID-19 and you do have POTS without other risk factors, that your symptoms of postural orthostatic tachycardia will manifest in a much more significant way. So the key principles of management, if you were to develop COVID-19, would be to maintain a very good hydration status. So aim for at least 3 liters, if not more, a day, despite the reduction in appetite that you might have during the illness. Keep your salt intake good if you know your blood pressure is on the low side, and maintain a positive attitude. And of course, follow the government advice to self-isolate and to take adequate precautions, including social distancing and hand washing.